Thank you. Hello, everyone, and welcome to today, which is a very exciting day for all of our health services here. I'm Jenny Courtney. I'm the Director of Community Engagement at Ballarat Health Services. I'm just going to do some housekeeping before I throw to the board chairs. For those of you who haven't joined one of the Ballarat Health Services Zoom media conferences, it's something we developed through COVID because we haven't been able to have visitors on site. If you can stay muted with your cameras off through the entirety, that would be fantastic. You can record the visuals and the audio and use as you see fit for your various different outlets. Any additional questions can be put into the chat function. Thank you so much for taking the time to send through the questions in advance. We have a lot to cover off today, and this is just the beginning of the conversation. So hopefully, if your questions aren't answered in this session, then we can work together to line up some more interviews definitely over the coming weeks. And if you have any issues with seeing the right person in the view, if you switch to speaker view, that should get the person who's not muted, who's speaking, to be the main visual on your screen. I think that's all for now. So I'll throw to Natalie to do an acknowledgement of country. Thank you.
Thanks, Jenny, and welcome everyone. It's a proud day for all of us, and we want to acknowledge the traditional land owners of the land on which we are all standing today and pay our respects to elders past, present and emerging, and extend that respect to any Aboriginal people here today. So I'll pass over to Mari to launch the event.
Thank you, Natalie, and good afternoon, everyone. Today is an exciting day for rural health. Thank you all for making yourselves available on short notice for this important conference. My name's Mari Aitken, and I am proud to be the board chair of Wimmera Healthcare Group. We have campuses in Horsham and Dimboola. Because Wimmera Healthcare Group is committed to improving and expanding the services we deliver locally, we are really excited today to be one of the 4 health services requesting that our Minister and Department Secretary consider creating a new and innovative rural health service in our region, a brand new health service designed to improve health outcomes for country people in particular. Despite our best efforts in our part of the state, we face much worse health outcomes than many other Victorians. Some cancer rates are up to 50% higher than in other parts of Victoria. Diabetes is 30% higher. Respiratory disease-related premature death is 30% higher. The Rural Health Commissioner's data tells us that the most remote Australian citizens have a life expectancy that is a staggering 18 years less than our city counterparts. And this data does not include First Nations people whose life expectancy is even less. These are dreadful stats. At Wimmera Healthcare Group, we've opted not to stand back and ignore this data, not to keep doing what we've always been doing because that isn't working. Through extensive community consultation, we've learnt that our community also wants to be able to access more services in their hometowns. We know that our community is travelling more and more for medical care. And we also know that, more worrying, many community members opt not to travel because it is just too hard. Through the consultation, we've also learnt about the community's health priorities, and these include mental health services, maternity services, chronic disease management, in-home care, dental services, orthopaedic, paediatric, heart disease and cancer services. These are realistic expectations for our community to be able to receive these services, or most of them, close to home. Our amazing and dedicated workforce strives to deliver the highest possible level of care, and they do a fantastic job. Access to specialists and other healthcare providers means that this has become increasingly challenging in recent times. Over the last decade, or maybe closer to 2 decades, it's become increasingly difficult for us to attract the skilled workforce we need. By becoming part of a large entity, we will be able to scale up, making a range of specialist appointments available in a way that is not currently available due to our size. This exciting proposal will not only improve health outcomes, we believe it will have a knock-on effect, making our beautiful Wimmera an even more compelling place to live and raise families. This change will set up our health service to provide better local care that people will choose ahead of other options because it is so good. And it will be designed by our community, for the long-term future. Our 4 health services are absolutely determined to work together as equal partners to make this all happen. Okay, I'd like now to introduce and hand over to my colleague and fellow board chair, Mr. Philip Sabien. Philip is the board chair of Edenhope Memorial Hospital. And I'd just like to say thank you very much, everyone, for your participation today, and hand over to you, Philip.
Thanks, Mari. Look, welcome everyone. This decision is an important milestone for all our health services. It comes after an extensive decision-making process, including consulting widely across all our communities and undertaking a very detailed due diligence process. The process has revealed how we can provide better, safer, more accessible and sustainable healthcare for our patients and residents, and has highlighted the scale of the opportunities we have if we all work together. We've identified new and practical opportunities to provide more services locally and reduce the need for patients to travel, ultimately increasing the access to care and services closer to home. I'll hand over to Rhian Jones, the chair of Stawell Regional Hospital. Thanks, Rhian.
Thank you so much, Philip and Mari. Thank you, everyone. I'm Rhian Jones and representing Stawell Regional Health. We are thrilled to be actively participating in this partnership and launching today. Further to some local planning a number of years ago, we really wanted to improve the health outcomes for local people, to improve access to services and ensure that we give our people the best outcomes with the best care in the right place. We're so excited today to be able to put our plan into the Minister's hands and to tell our community that we are ensuring the future of Stawell Regional Health for their futures, their children's future, and the healthcare of our local people. Thank you so much for this opportunity.
So over to you, Natalie.
Ballarat Health Service is extremely proud of the journey that we have been on with our regional partners and look forward to a prosperous future together as we optimise the health benefits of the Ballarat Health Service for the broader region. So looking forward to working with these wonderful partners as we have done through the preparation of this planning over the last 12 months.
Thanks very much, Natalie. So what I've tried to do is combine the questions that have come through in advance and to cover off as many of them in the time that we have. So the first question I'm going to ask of Rhian: why do we need another health service?
Thank you so much, Jenny. In the past year, we learnt just how well we work together, all of our health services that are here today. And after the extensive planning that we've been doing in this past year, we found that there were terrible inequalities facing our local communities, and Ballarat Health Services activity is ever increasing. So our proposal to the Minister was driven by our desire to improve the breadth, accessibility, quality and sustainability of local healthcare. There'll be no loss of services, no net loss of jobs, retention of all entitlements. Fundraising will always remain tied to each community that it was raised for. And I suppose COVID, unfortunately, has given us this insight, and we hope that what we have learned we can put into practice now. So it's a wonderful opportunity.
That's great, thank you. So now one for Mari. You've been involved from the very beginning. Can you tell us how the boards went about deciding that this was the best option and the process that's been undertaken? Sorry, Mari, you're on mute.
Mute, yes. Thanks, Jenny. Sorry about that. Wimmera Healthcare Group, like Rhian mentioned with Stawell Regional Health, became aware through the COVID process and other processes just how much better we are when we work together. And on the basis of that, we started to think about maybe this should be some sort of permanent arrangement. And so we started the conversation. I approached Natalie initially, and from there we started to engage with a consultant to start to explore whether this was a good idea or not. That's about 18 months ago that we set the ball rolling, and we've gone through a very extensive process since that time. We were encouraged to invite other partners to join the journey, which we did. We invited all the health services in the region to consider whether or not they wanted to be a part of that. And at that point, Stawell and Edenhope joined in on the journey. So since then, we've done extensive community consultations. In our part of the world, we made contact with over 1,000 participants or 1,000 community members. We then moved into a due diligence phase where we looked at whether or not there were any prohibitive barriers to us actually joining together, and found that there were no prohibitive barriers. And from there, we moved into the more detailed business case planning. So it's been a slow and careful process with us thinking very deeply about this huge decision every step of the way. And in the last fortnight, each health service board has met and independently reached the same conclusion, which is actually very reassuring, I think, for all of us, that we've all come to the same conclusion that this is a good idea to pursue.
Thank you. So just coming off that one for Natalie, one of the main concerns for the region is the loss of services. You've spoken a lot today, all of you, around this is an opportunity for growth of services further afield than Ballarat. So how can you guarantee that there will be no loss to services in the region?
Jenny, I think we've all learned through COVID that the opportunities for regional are better than ever. And we, as for health services who have made this decision, have done so with a strong commitment to not just the retention but an improvement in services in the broader region. You know, we would never have gone down this path
Sorry, Natalie, we seem to have just lost you halfway through the sentence. Sorry, Natalie, I'm just going to mute you. Avril, can you mute Natalie?
Principle of the agreement that,
Right, I think that we've lost. There's Natalie. You may have gone through a tunnel and now you're on mute. So if we unmute you. Avril, can we unmute Natalie now? It's gremlins.
It is not letting me unmute her. Sorry, Natalie, can you unmute yourself? She might be frozen again, in which case she might need to turn her camera off. Natalie, do you want to try turning your camera off and leaving your microphone on?
Sorry, we would never have gone.
No, that's not helped either. I might leave you for a second, Natalie, and go to the next question. Hopefully the gremlins in the system will remove themselves. So, Philip, I'll ask a question of you. How will all the competing priorities of so many diverse communities be considered to ensure that smaller communities don't miss out through this process?
Thanks, Jenny, and chairing a board that is surrounded by small communities. There are multiple mechanisms that will be put in place to ensure that the local voice and needs continue to be put at the centre of service planning decisions. Now, these will include governance, financial, strategic and clinical planning and legal mechanisms. We need to ensure that we do everything to improve the long-term health benefits for all communities following the creation of a new entity. This means providing more services closer to home for more people, so that patients, residents have to travel less distance, less often to receive the healthcare that they need.
Thank you. I will ask a follow-on question of you, Philip, because the next one was for Natalie, but I'm not sure that she's back online. There might be benefits in the short term. So we've had a few questions around this sounds great in the short term, but what guarantees can we give around services continuing for the longer term?
Well, look, even under the current arrangements, no one can promise that services won't change in the future. They may change in the future just as they have in the past, but we're confident through this new structure that we'll provide the best opportunity for continued and increased range of services that care that meets the needs of our communities. However, with the new health service, there'll be many elements in place to protect these long-term interests of providing local health care. Now, these include bylaws of the entity would embed the requirements to provide healthcare services in each local community. The boards and the CEOs are bound by these bylaws. The services provided at each location would be subject to service planning processes, and that includes consultation with the local communities. The local community will have a say in any proposed changes to services in their local area. A new health service would have performance requirements from the Department of Health, through a mechanism called the Statement of Priorities. And that will include clear service delivery requirements for those communities. So any proposal to change these requirements would have to be approved by the department and by the minister. A board of the new entity will include representation from all communities, from all 4 health services that have expertise in rural health, so that local concerns will be heard. Also, there will be community-specific advisory committees set up that will be established and maintained to advocate for local services and to ensure their importance is understood. There'll be a clear and transparent implementation plan for the new health service with key performance indicators and an oversight by a dedicated board committee with representation from each community will be provided.
Please note that there were technical issues during the event, and as a result, 1 to 2 minutes of the event did not record.
Of us coming together under the one umbrella. So the region can look forward to an extremely bright future in terms of the provision